job is to make sure this stuff got done.
Okay, I thought I was under the understanding it was Dorothy.
Dorothy is
from Denver.
it's been sent to them. I have
Okay.
not went to Zoom to see if they're there or not.
Okay,
Were you gonna check on that or?
no, just see if somebody, we need to make sure they're allowed in, because they're gonna
I lost
report.
my Zoom link now. We gotta,
Vernon sent me the information that he sent to her relative to getting on. to
Okay,
the
well, she
Zoom
just
call,
needs to keep trying until
until she can do
until
it.
she's allowed in, which he should have done by now.
Would seem,
So the Zoom link's up. And
Thank you.
everybody,
Jordan, can you hear us?
yeah,
Okay, there's somebody else supposed to be dialing in, Cliff said. What's her name?
Megan Snow.
Megan Snow is gonna do some of the briefing today, I guess, huh? Discussion.
20-minute presentation, Vernon sent it up. To me and to her.
And Jordan, if you've heard, maybe you heard me talking, I'm gonna need you to set up another Zoom call on Monday, and I'll give you the details here in a little bit.
yeah, I know, I didn't hear that, so yeah, if you,
Okay. We'll talk after the meeting here then. But she delivered you a little pad already.
Oh, I even know.
And all the handouts here now?
Delena's coming.
Okay,
Thank you.
we'll wait.
So, Bill, I understand correctly, I'm supposed to continue to send to Jennifer.
Let's talk to Robin
Okay.
to clarify that again, because all Dorothy volunteered to do
Right.
was to do the agenda.
Right, that's what
And-
it-
yeah, so
So I'll have to figure out what deal Robin made, and I don't know where, I don't know, Jennifer just texted me back and said she hit the text her, so. And I said where all the packets were, so she hadn't responded back, so.
yeah, we need to all make sure we're all on the same
Same
page.
sheet
here.
again,
I can help and do it, whatever you guys need. I just need to know. about
until we
it.
get an admin,
I just need to know what you need me to do.
or you can offer Delana.
You can always send,
It can take minutes,
Send the bill
too.
to us.
you can always
Board
send
of
it to Bill.
Commissioners.
Bill's
Yeah.
got government experience. So it's two papers together.
Yeah, that's right, I can staple things together for the meeting.
Is that a stable commodity?
See anybody online besides,
I'm trying to get
you're not in yet?
there. Three people, myself,
And you
and
have
two
the,
Custer County hosts.
you have a
So,
hard copy of the agenda.
no one else is online at this time.
No, I do. Is that part of the packet you gave me?
Yeah, it's what I gave you
Okay,
the copy.
it's on its way.
Okay. It's on its way.
We'll get this. Together.
It's okay, it's not a big deal. As long as we don't lose the person that needs to be participating. You got a phone number for him? Marjorie
I
Snow.
don't even have my phone here. I keep leaving my phone on and interrupting the meeting, so I left it.
What?
Left it back at the office.
Reminds me, where's my phone disappeared to? What's right in front of me?
At the present time, there's nobody online other than myself and the two co-hosts, Custer County.
Why don't you call, well, I'll call. Does Rhonda have the phone number for her? Who's over there now?
I don't think so.
Would Lee have the phone number?
You-
Probably not. Do you want to run over and get it?
Yeah, I can, I'll just try that.
Okay.
Oh,
Yeah, we can start.
okay,
Don't want to waste your time. Get started. Me first?
I think you.
all right, let me start the meeting first. All right, I'm gonna call to order the Board of Health meeting for Custer County on Wednesday, November the 15th, 2023 at exactly 1:44. today. So if you would please silence your phones and let's stand for the pledge. And Cliff, why don't you start us off?
Pledge allegiance
To the flag
of the
United States of America,
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks. Okay, Dorothy, you can improvise a roll call.
Oh, Commissioner-
Board of Health member.
Board of Health members, gosh, it's been a while.
Here.
Mr. Panda. Mr. Day.
Here,
Board of
Mr.
Health.
Rett.
present.
Peggy Martin.
No, hold on.
Oh.
It'd be the next would be
And
the,
Mr. Brown, Dr. Brown.
Here.
okay, so everybody's here now, audience introduction. Now you can say who you are.
Okay. So Peggy
Sure.
Martin.
Just let her do it. There's no hurry.
Sarah Bertelson.
Is everybody online yet?
No.
Okay, Cliff, why'd you go grab it? And we don't have any minutes to approve. Oh, here she comes.
I think the person with the.
This is Delana. Okay, good. And that's Delana. Okay, and I don't have any, from a Board of Health point of view, any items that either of you guys have anything to bring up right now?
no,
Lucas, you got anything Board of Health wise? Okay, the only thing I want to bring up is Dorothy. Sanitarian wise,
thanks, Delana.
at some point, and I haven't brought it up as an agenda item, we need to take a ride out in Boneyard Park and look at the homeless camp that's out there.
Right.
And see what's going on, because they've been there for years apparently, and it's gotten worse, so.
And you had mentioned that during one of the board meetings, but I
right.
never did get an address, so.
Right, so what I'll do, I've got a person that I can talk to, and I'm gonna go make an incognito run without. Well, bells and whistles, and figure out where we need to see things.
You let me know what you need.
Yeah, and we'll go with you and Dr. Brown.
Sounds good.
Okey doke. And with that, there's no items other than that. You don't have anything else, do you, Dorothy?
No.
Okay. Okay, so while we're waiting for the other stuff, let's go ahead and introduce yourself and tell me what you're gonna do.
Okay, Peggy Martin. I'm a registered nurse with Public Health. Dr. Brown had asked me to give you a little bit of my background. Been an RN for 48 years. I've been with Public Health for about 2.5 years. If you count my volunteer time, it's 3 years.
Okay,
Because
I'll
I
count it. I'll
volunteered
count it.
there. Anyway, we're gonna talk a little bit about, do you mind if I stand? Because I'm
Should
really
stand,
short.
that's good. And you can feel free to use this table if you need it.
Okay, I'm just really short and I don't do well sitting down. Deaths from COVID, basically. Your cause of death in the end is a cardiomyopathy. So it's an enlargement of the heart. It comes related to pericarditis, which is an inflammatory process of the heart, of the heart sac. Myocarditis, an inflammatory process of the heart itself.
So hold on just a second. So your topic that you're discussing with us now is.
COVID.
You're just gonna discuss COVID and there's no handout for it right now. Okay,
I'm gonna
good.
show you a little graph here
Okay,
of
good.
what our COVID data looks like. I'm gonna pass this around compared to last year. Right now, we don't have very many cases in the county. Specifically October, we had 4. But I would like to remind you from a public health standpoint, it's been a very warm fall. October and even into November so far has been quite warm.
Sure has.
And that will definitely impact the COVID cases because the more time people spend indoors with closed windows, the more cases of infectious disease you're going to see. So I think that's why our numbers are down. If you look at our
So this is a death count here, case count.
case count. Yeah.
Yeah, it does. Okay, I see it on the side there.
Yeah. We also have a little chart on hospitalizations for flu. So far this year, none. The big spike was last year, November, December, January, were our spikes for last year. But primary causes of death in COVID are related to heart damage. So also some blood clots, but some of those stem from inside the heart itself, others from inside the blood vessels. So an interesting tidbit that Dr. Brown found about COVID. So I'm gonna have to step back a bit and give you a little bit. I don't know if you know how health data is calculated. When we look at per capita vaccination rates, so usually that's number of vaccinations per 100,000 of population. Canada had much higher vaccination rates than the United States. And they also had a lot more draconian lockdowns than what was done in the United States. And yet the United States had less deaths and less deaths from comorbidities. So some of the things that were done in the counties where it's severely locked down actually were detrimental to health. And some of that's related to mental health issues. Some of it's related to the stress from being locked down and the health issues.
So some
that
of it's
come from
natural
that.
immunities that are a result of
Yeah.
being infected.
Lots of different things can play into that and not a lot of data that tells us exactly why.
Mhm.
So I'm gonna jump down the agenda a bit. Do you want me to go ahead and do all of my stuff while I'm here?
Why not?
Okay, I'm also the person that's in charge of the AED inspection program for the county.
Oh, we want that person that's culpable for that.
Yeah.
Now we know who to hang.
So part of our issues, we need to order, we have ordered a new AED for the landfill. We are going to be ordering one for the airport. They are currently back ordered 3 months. The approximate cost on those is about $2,000 a piece, plus or minus 20 bucks here or there. What we're finding, I've done inspections with Road and Bridge and have them all up to date on all their equipment. I'm not sure that their equipment down in Wetmore is properly assembled. I need to get down there and take a look at that. Kind of quit doing this on around the end of September because September, October, November in public health is nothing but vaccinate, vaccinate, vaccinate. Everybody with an RN license is vaccinating flu, COVID, RSV. That's all I have time for. This will resume again once our vaccination season kind of quiets down. I'm trying to get out to all county facilities, physically look at all their
Check the
equipment,
dates of expiration.
everything. And not only that, but I want to make sure they work.
Yeah.
Just because they're not expired doesn't mean they don't work. So I am actually setting the thing up. I'm making it work in front of me. It was interesting when I went to the library, because the girl at the library said, when I'm going through the check, she said, I didn't know that thing talked to me. Not only do they talk to you, but the new ones will tell you how to do.
Now
CPR.
plug it in and plug me in, and then, by the way, bend over and hit him hard.
Yeah, pretty much.
The only
So-
one we have in the county building is that right by the old.
I checked the one in the county building, it's fine.
But that's the only one we have.
Yes, you have one in the hallway there and
So
that's
somebody's
it.
gonna have to run upstairs with it or down the hall, something happens, or in the courtroom.
Right,
Is there one in the courtroom?
It's in that hallway
It's in
between the
hallway.
DMV
Well, that's
and
what,
the courtroom.
okay, yeah, I know where the one is down. I thought there might be one inside the courtroom. Okay,
No, according to the people that I talked to over there, that's the only one in the building.
okay.
And that one has been checked. So I'm also in charge of the monthly senior outreach. I go up to the senior center every month and do blood pressure checks, pulse checks, oxygen saturation checks, and we do vaccination clinics at the senior centers. And we will do both flu and COVID this year. We've done flu. We have had some supply issues getting our COVID vaccine, so those are a little late happening this year. But we will be doing that. We also do outreach at Valley with both flu and COVID clinics.
Mhm.
Again, flu is done, COVID supply issues, and we do the same thing down in Wetmore. So we try to service the county by coming out to where people are, so they don't have to make a long trip to make sure folks get vaccinated. RSV, we are not gonna be offering as a clinic this year. The vaccine is very expensive.
$270 a dose.
Yeah, the vaccine's very expensive, and sometimes when we go out to these clinics, we don't have a lot of interest. And we don't want to risk any vaccine getting compromised at that kind of price point. Because that's an awful lot of cheaper vaccines that we could be giving to a lot of people. Any questions about any of that?
So AED wise,
Yeah.
we're only short at the landfill still,
The landfill is on order.
and
The airport, that I need to get back in touch with the gentleman, he was gonna run it through the board to make sure they wanted one. He was pretty sure they did. So I have not ordered that one yet. I'm waiting to hear from him. I forget his name right.
Clyde Butler.
Clyde Butler. That would be who it is. So I've been waiting to hear from Clyde for sure before I place an order for him.
Okay,
Facility probably should have, whether.
whether they want it or
the board
not,
wants it or not.
yeah,
Oh, you want them to have one, whether they.
yeah.
they
That's
want-
a,
I
that's a
don't, they
county
can,
building that's not close to anything else.
and in an airport especially, get it out there, that's fine, and
Okay.
we're
I
paying
can-
for it anyway, there.
You're right. I can just go ahead and order one and we'll make sure that that all gets set up out there.
Good,
I might speak to the community building in Wetmore, because when that was initially,
I think they have one down there.
they had two. But I believe when those go defunct, they only need one in that building. I mean, the same as here, when the
Right.
remodel happened is when they had to. And then we have since replaced the batteries in both of those units, but I think there's only a need for one there.
do you want to volunteer moving one of them, is that what you're saying?
I don't know if you would want to move one because they are the older models. And then I know the fire department down there, which isn't a county entity, has, I believe, 2 or 3. They've got them in a couple of their trucks.
I have not been down to Wetmore to physically check the one Road and Bridge has down there or the 2 in the community building. And what I'm doing as I make these visits, I'm also making a list of brand, model number, so that I don't have to go down and if they tell me they need new pads again, I don't have to go down and figure out which brand and model I need to order for. I already have that on a spreadsheet. So that is on my to-do list as soon as we get through all this vaccination season. To make a trip down to Wetmore, I'm gonna try to round up every single one of them that's down there that's county owned or otherwise, that I can check for them and make sure that everybody knows whether their equipment is working or not. And if it's not, what we need to do to make it work. Sometimes we can't fix them, sometimes it's a $500 battery, sometimes it's $60 in pads, it all depends.
Yeah.
Okay?
Thank you.
Mhm.
Okay, excellent. Okay. My name is Sarah Bertelson. I've been a nurse for 8.5 years, will be 9 in February. My background is in maternal child health, mainly postpartum and obstetrics.
Sarah,
I've done-
how do you spell your last name?
BERTELSON.
Okay. Okay,
All right, so I am a lead nurse full-time at Public Health, and I've been at Public Health full-time since June. Here we are, and since I am the lead nurse, I'm in charge of all the vaccinations, inventory and everything, oh yes. And so the lovely packet in front of you labeled Custer County Health Vaccine Statistics, take a peek in there. We have generated data about all of the vaccines, especially our high-paying ones, here in this packet. I won't read you everything, but if you have any questions, please let me know. I'll highlight on a couple of them. So we had our flu clinic this year.
before you do that.
Mhm.
You actually vaccinate babies 6 months? At
Yes.
6 months,
I vaccinate down to 2 months.
really?
Actually. Mhm.
Wow,
Yep, your first set of shots post hospitalization is 2 months.
Okay.
2, 4, 6, 8, a
Cool.
year.
That's
Oh,
the
yeah.
first time you get to make the baby cry.
yeah,
I used to make them cry in the hospital. That was me.
but at least
Unless
it's
a
at
boy
a
and then it's a
stage
lot-
in their
a lot
eyes, so
quicker.
at least they can't remember it.
Right, right. The circumcisions are the fun
Oh,
part.
that would,
Yeah, that comes before.
I'm
2
glad
months.
that I don't remember that either.
Excellent. And so we pulled data from last year's flu clinic and this year's flu clinic to kind of calculate what our best course of action is. So last year's flu clinic, they did it over the course of 2 weekends. So once on a Friday, once on a Saturday. This year, we did it in 1 weekend over a Friday and a Saturday to kind of compare, do people like the convenience of, hey, it's one event, 1 weekend. If I can't make it today, I can make it tomorrow. Our numbers reflect that we really want to focus probably having the flu clinic be 1 day after we pulled our data. It's just more efficient and it's a better use of our volunteers. And Friday seems to be the more popular date throughout both years. So coming up next year, we're considering doing 1 day, extending the hours from like an 8 to 2 or 3. So that way we can try to, cover most of the people that we've seen per our data. So, as for COVID, as Peggy was touching on, we have so far this year vaccinated 239 individuals with COVID. We currently have 8 on our schedule. We have a wait list of 93 left out of 200 plus people. So we first received this monovalent back in the end of September, early October, and we have vaccinated that many people, which is pretty impressive, with a high demand and shipping issues. So it has been quite the challenge, and they only send us 50 doses at a time at maximum. So we have been coordinating quite a lot. Nurses have put in extra hours, and we're making a dent. So, yay.
Maybe we should trade a few cases of masks for it or
I,
something.
if you have any secrets, I am open because these manufacturers have just been quite the delight to work with.
And it's not just us.
It is not just us. It is, we're talking even the big boys, Walgreens, Walmart are having trouble keeping stock and
Yeah,
supplies.
Walgreens couldn't get the Moderna vaccine. I went down there a couple weeks ago to get mine.
Can't.
No vaccine.
Mhm.
You don't trust anybody up here to stick a needle in you?
No, this is why, you need to know. I didn't want to take a vaccine away from some of our elderly disabled people who couldn't get down the hill.
There you go.
All right.
I would rather go down the hill because I can get down the hill.
I had to ask the question.
Did their shots hurt?
More, but
Yeah.
we thought of renting skateboards and just turning people loose going down the hard travel. With our elders.
And we've also seen an increase in COVID testing, but it's really hard because nobody reports back to us. So it makes it really hard to track these cases and or outbreaks. So that's been something that we've seen, especially in our older population. We've had a lot of people stop by for free test kits, especially in the past, 2 or 3 weeks,
Right.
especially. So, but yeah, if you want to take a look, the most impressive numbers that I like, they're very big, is towards the back, is our overall total vaccinations provided in the year 2022 and 2023. In 2022, we've provided, and some aren't listed, this is mostly adult vaccines, 1875. That's a pretty significant number of vaccinations given. And this year, we're not doing too bad. We're at 1,049. And with all the shipping issues, I say we've held up pretty well.
That's great.
All right, and then moving on, I am also in charge of our dental grant. And so we recently held a cavity-free by 3 event in correlation with Traveling Smiles. They also visited the school. For cavity-free by 3, we had 3 participants. And at the school, we served 16 children total. 10 were from the school and 6 were homeschooled. So we got some connections in the homeschool population, which has been fantastic. And so word spread, and we're really able to spread our resources a little bit more evenly across our county, which is wonderful. We also recently participated in the trunk or treat event with Peak to Peak. I have pictures if you guys have 2 seconds to look at them. We got to dress up. We had Peak to Peak has an ambulance that she's converted into a dental office. And so the ambulance was dressed up as a monster. We had a spinning wheel, we had prizes. We were all in costume and theme, and we gave away crayons, toothbrushes, pencils, and we almost ran out. We underestimated participation, and so we had to make some stretches, and we had to get really creative with like a high five or a dance. But overall, we had over, I would say, 200 children visit our booth, which was fantastic. And I'll show you those pictures in just a second.
What else did you give out?
While she's getting ready, we also have, in that dental, we also have these.
Snacks.
Oh, really?
So, and we are
Educational.
Most of the kids that have not had much have been on the Amish side of the.
So from a vision point of view, what'd you do? Just give them an eye test, any glaucoma stuff?
We don't give glaucoma tests usually for kids.
Yeah, I didn't
Because
think
it
so.
doesn't start showing up, but
That's
we've
cool.
had to depend on the school nurse,
Very neat.
instead of taking it
Did you see him,
ourselves
Kim?
this year, so
That's cool.
we have, it was basically kids who are having problems not wearing glasses, lost their glasses, couldn't see the blackboard, whatever, so yeah.
Oh, that'll be to come. That's one of my other lovely projects. So, overall dental, we're seeing a really big use in our grant funds. To the point where we might even need to ask for more money because there's a huge need in this community. So, we've been really working well with, the Children's Health Fund, who supports us in doing future projects and outreach to, Amish communities and our homeschool communities. So, as Dr. Brown was talking about our vision, Dr. Claflin is our provider and will provide a child with an exam and corrective lenses through our vision grant. We can service 6 children this year with the funds that we have, and we've been in contact. I'm awaiting school referrals. And then we are also recently collaborating with the library. And so we're hoping to hold homeschooled and Amish vision and hearing screenings to help stretch and evenly distribute our funds. Library, as Kevin found through here, we have been attending play groups and doing health-focused presentations. And so this last one was about going to the doctor. And so the kiddos had their stuffed animal patients, and we talked about what the doctor does, what types of tools they use. I brought demonstration things so that they can get their hands on, and it will hopefully reduce the fear, because I asked the question, this was a 3 to 5 year old group, what's the scariest thing about going to the doctor? And of course they said in unison, shots. So I brought little tubes, and we practiced vaccinating our patients. So it would take the fear away and be able to let them hands on and realize, oh, that's not so scary. So we had a really, really great time, and we've been invited back to do the same lesson. Actually, this was post Halloween, so they had a lot of kiddos from a Halloween hangover not attend. So we had a group of 5, small but mighty. And so we're going to do it again when we have a larger group and get to have more fun. The library has also allowed us to do a hospice presentation. And so we had a volunteer come in and ask, hey, would you guys like to come and present? And so I've been working with McCarthy at the library, and we have reserved a space for February 6th about what is hospice, who needs it, who qualifies, and would you like to volunteer? What does volunteering for hospice care look like? So that'll be really exciting. And then moving forward, we have hosted a health fair in the past. The company that we have been through working with is no more. So in order to supplement the lack of a health fair, we are considering doing monthly or quarterly public health presentations, focusing on those that would normally present at the health fair at the library, so we can still provide and promote services throughout our county, just in a smaller and more intimate setting.
Does that mean normal health care and people get in and get their blood pressure taken, they get their eyes checked, they get a heart, whatever?
Exactly.
So you can do that separately then?
We would just focus it, so blood pressure and nutrition, SAR could come in and speak 1 month. Solvista, the fitness center, was another big participant. UCOG, we'd really like to have UCOG come and present about all of their services. And so we just take a focused approach and try to get people to attend that way, since we do not have the funds at this time to produce a health fair like we have in the past.
So the other is defunct. I'm glad we got one in there.
Post-COVID.
And real quick, just for your information, Megan is online.
Oh,
Do
good.
you want me to?
Yes, if we could go to Megan, we could continue with the rest of the.
Okay, is Megan, you there?
And Stacy's online as well.
Oh, and
Yes,
Stacy too.
I am here. I apologize. I think there was a miscommunication about what time I needed to be joining, so my apologies.
Hey, we're all happy.
And it looks like I'm not able to share my screen. Are you able to allow me to share my screen? Or, as I had slides, prepared.
Jordan is there and maybe hears it.
I will see if I can get a hold of him in case he did not hear that. He's doing something there on the screen.
It'll
Well, in
it'll
the
happen.
meantime, oh, there it is. Thank you. I see it. Thanks.
Did you get that permission?
I did, yes.
Well, call him then.
Be careful what you call it.
Right, and let me go into presentation mode. 1 moment.
Unless you're
Go ahead.
connected, you'll have to look at that.
I know.
Okay, can you guys see my screen okay?
Matter of fact.
Yes.
I'm awake to them.
Yes, okay, great, thank you. So thank you for Cliff for inviting me to speak about lead poisoning prevention in Colorado. My name is Megan Snow. I work at the Colorado Department of Public Health and Environment, and I'm the program manager for the Colorado Childhood Lead Poisoning Prevention Program. And we're just going to kind of go over a couple of things related to my program and what is happening in Colorado around lead poisoning prevention and lead testing. So for folks that aren't aware, which I'm sure most of you are, but just to be safe, lead is a type of metal that is found naturally on Earth. In Colorado, it's a naturally occurring in our geology, in our soil. It's something that is just part of our geology in Colorado. So essentially, it's just kind of, depending on where you live, something that's part of your natural environment and is surrounding your home. It does have beneficial uses. Obviously, it's a very durable metal, but it is toxic to humans. It can get into our bodies when we breathe or swallow or breathe or swallow something that has lead in it, and it can affect almost any organ in the body, but the main concern is the nervous system. And that's particularly concerning with children under the age of 3 or pregnant people. Lead poisoning can have pretty severe effects on your brain development. And children under 3 are on the floor a lot more. There's a lot more hand to mouth. So the likelihood of them coming into contact with lead dust or any other common sources of lead and putting it into their mouths is much higher than most of the population. So we focus a lot on children under 3. There are a lot of common sources of lead. It's not just naturally in our soil, but it was in lead paint until 1978. It was used in lead pipe and water fixtures until 1986. There are a lot of home remedies that folks use that contains lead. Imported spices, that's a very common source, can have the potential for lead in it. There are some occupations where a parent could be bringing lead home because it's on their clothing or on their shoes. And then there are hobbies such as hunting, fishing, things like stained glass where you're soldering with lead. And then obviously that lead soil can be tracked into your home. There are other common sources of lead as well that we're finding. Folks who live next to lead or close to lead smelters, battery recycling plants, small airports, jewelry, baby food, which I'll touch on towards the end of my presentation, cat litter, which is an odd one, but there are some brands of cat litter that do contain lead. Imported candies, mostly coming from Mexico. We do see a lot of imported candies with lead. Dark chocolate has lead in it. A lot of it has lead in it, mostly because that's being imported from other countries. Fishing sinkers, recalled toys, very common still, that toys that are being made in other countries and being shipped here can still contain lead paint. And then imported powders for religious or cultural celebrations. It's very common in Nepalese communities to use powders on your face when celebrating different religious holidays, and they put that on everyone's face. Adults, children are using these powders, and we have been finding that this is a source of lead when we're doing in-home investigations. So
Megan?
again, yes, go ahead.
Let you know, I did run off for them the Hond that was just produced with lead in the applesauce, high lead level. So just letting you know, they do have a little bit of information in front of it.
Perfect. Yeah, and I have a slide on that later. So thanks for mentioning that. Yeah, there was a recent recall that is having a pretty large impact that I'll touch on. But lead poisoning is difficult to detect. Likely you're not symptoms in a child until they've already had very high levels in their bodies, and it's caused irreversible neurological and developmental impacts. So it's not something that you're going to find is showing symptoms. And so it's really important to test kids for lead poisoning because it's not something that we can physically see a child displaying until it's too late. And then our program is CDC funded. We've had this CDC funding since 2014. We are funded to provide reporting to local public health agencies when we get a blood lead test from a provider or a lab. We also try to, the best of our ability, encourage lead testing both at the community level and the physician level. We do surveillance across the state to make sure we're not seeing any clusters or any areas of concern. And then we also help provide improved services to children who have elevated blood lead levels by connecting them with resources and talking with their provider about what they can do going forward to treat the lead exposure. And then trying to develop policies for targeted and population-based interventions with a focus on community-based approaches.
Can I ask a quick question then?
Of course.
So do we have a problem here in Custer County at all?
So I was looking at the data this morning, and we have a targeted lead outreach tool where we look at age of housing, so housing pre-1978, and poverty rates. There is a connection between income and a child's risk of lead exposure, typically because they live in older housing and that housing isn't always taken care of. There also is a connection with families that are, first-time arrivals or immigrants. And so looking at poverty and looking at age of housing is a really strong indicator for risk of lead poisoning. And then we overlay that with what is actually happening in the county. Are there testing rates good? Are you testing the children that need to be tested, and who are those children? Colorado is a targeted lead testing state, not a universal lead testing state. So there isn't any sort of state mandate or law requiring lead testing, but there is a federal law that all Medicaid children at ages 12 and 24 months, so they should be receiving 2 lead tests, 12 and 24 months. There is that federal Medicaid requirement, and we do follow that Medicaid requirement. So we look at Medicaid, the number of Medicaid children in each county overlaid with age of housing and poverty rates. And in Custer County, and we look at it by census tract. So a smaller scale, we're not looking at it at just a county level because some counties in Colorado are massive. So you have 2 census tracts in Custer County that we look at. And there is one census tract that has a moderate risk and low testing rates. And then you have one where it's moderate risk and moderate testing rates. So it just kind of depends on where folks are living within the county. And so ideally what we would want if there was any sort of moderate to high risk is that there would be high testing rates, especially among those Medicaid children who, per the federal law, should be receiving a lead test at 12 and 24 months. And if they don't, they need to be receiving a lead test before the age of 6. That's where, that line has been drawn in studies where that's where the largest developmental impact is being seen, is at those kids under the age of 6, but especially kids who are under age 3. And across the state, y'all aren't the only ones. Lead testing across the state is very low. For Medicaid children at 12 or 24 months, the testing rate is 23%. That should be closer to 100%. At 12 and 24 months, the statewide testing rate is 2%. So lead testing is just not happening. There's a gap there, whether it's access to care, families not understanding what lead testing looks like, or if they should be receiving lead tests, and also physician beliefs or knowledge about the importance of lead testing.
I got another
So it's
question.
just, yes, go ahead.
So let's suppose you have a baby that goes through in very high areas and gets it here, continuously. It builds up, right? Is there with time, and it doesn't go away, does it?
So-
Or does it wash it out after a certain time or a certain age
Yeah.
or something? Does it?
Sure. So as long as you remove the exposure and you take appropriate medical steps, you can reduce the child's blood lead level. So let's say a child comes into contact with what I'm going to talk about here in a little bit, this recalled applesauce. And they've been tested and it's at 13 micrograms per deciliter. The blood lead reference value that we follow per CDC is 3.5 micrograms per deciliter. So anything at 3.5 or higher is considered elevated. So the child, let's just say, has 13 micrograms per deciliter of blood in their, or lead in their blood. There are things you can do. The first and most important step is to identify and remove the exposure. That's how this recall happened. Had a child not been tested in North Carolina for lead, and if someone did not go into the home to do an in-home investigation, it's likely these products would still be on store shelves. And so that's why it's super important to test children, because these things, if we can't identify them, are just going to continue to be ingested by children. So we would first identify the exposure, and we can do that over the phone with the family, or if the level's high enough, we can do an in-home investigation. Once we identify the exposure, we remove it. Then from a medical perspective, there are some nutritional things that you can do to put in place. So change the child's diet. If you change the child's diet to include items that are high in vitamin C and iron, those can help actually absorb the lead and get it out of the child's blood. So obviously that recommendation needs to come from a provider. No one on my team is a clinician. We're just following CDC recommendations and guidelines, but there is clinician guidance and recommendations on CDC's website that walks a physician through how to treat lead poisoning. So you can reduce your exposure, but you have to identify what the child is coming into contact with in order to do that.
Megan, in answer to Commissioner Bill Canada's question, I have moved 2 families out of their residences and pretty well shut them down for anybody else moving in to that same residence over the last couple of years.
Is that right?
So we are watching, and I work in contact with their pediatrician, their family pediatrician.
Yep. Yeah, that's a common thing. What we're finding, and we don't have data in Colorado to back this up, but anecdotally we find that lead paint is the #1 common source of lead exposure in children across the state.
They loved eating it.
Yeah, lead is sweet, which is kind of odd, but that paint, the dust does have like a sweet taste to it. And plus they're crawling around on the floor and putting things in their mouth. So it just, it's hard to reduce that exposure if you don't know if it's happening. So, and then in Colorado, per our Board of Health rule, all clinicians and laboratories are required to report blood lead tests to my program, regardless of the result. So if it's elevated, it has to come to us within 7 business days. And if it's non-elevated, it's 30 business days. But all tests are required to come to my program so that we can see what's happening in Colorado, so that we can monitor for any clusters or identify any issues that we're seeing across the state. So what happens after a test is reported to CDPHE? It all depends on the local public health agency and the resources that local public health agency has. There are only 4 counties in the entire state that can do in-home investigations as part of their normal day-to-day business operations. So we've got Denver, Adams, Pueblo, and Weld County are the only counties in the state that have someone on staff who is a certified lead risk assessor that can go into homes. And so to try and help bridge that gap, our funding does not allow for us to fund that activity across the state. We are only allowed to do education and outreach and surveillance. And so what we have done is we've hired a care coordinator who can do over the phone like questionnaires with families with children of elevated blood lead levels outside of those 4 counties to try and figure out what's going on over the phone. But that's really not the best way to do it, because a lot of times, unless you're seeing what's happening in the home, it can be really hard to identify what is, what the child is coming into contact with. So for a child with an unconfirmed test, which means they've only had a capillary sample taken, which is a finger prick, we only contact the families, this is all on CDPHE's end, through a letter, a phone call, and then contact with the provider. We have to get a confirmatory test, which is a venous blood draw, in order to confirm the elevated case. Capillary tests are a good starting point, but the machinery that is used has been known to produce false positives, and that's why we require a confirmatory test. So once we get a confirmatory test in the state of Colorado for those 4 counties, if the child has a level of 10 micrograms per deciliter or higher, it triggers an in-home investigation. But if it's a 3.5 to 10, again, due to resources, we can only do an over-the-phone investigation, and that includes those 4 counties as well. And so here's what that looks like for a confirmed test. Again, most of this is falling on CDPHE just because locals don't have the resources to provide this. And it's a very obvious gap that we're aware of and are working to identify some funding, which I'll talk about here in a minute, to kind of bridge that gap. And that may be contributing to physicians not testing because they know there are not resources available. That's something that we're aware of too. So again, limited resources, our funding is, we have funding restrictions. We understand that there's limited resources at the local level and are trying to kind of fill that gap in the meantime. Case management and access to reporting is also a gap. So what are we focusing on? Things that we can focus on right now, which is education and outreach. We're primarily focusing on providers. We have always done outreach and education focused on parents and telling them the importance of blood lead testing. But we have been finding that parents who contact us will go to the provider and the provider will say, lead's an old issue. It's not a problem anymore. I'm not going to test. And that's just not the case. And so that's why we are changing our focus from families to providers. So we're working on provider outreach and education. We are doing an echo with the Colorado School of Medicine and Colorado School of Public Health to provide a very comprehensive webinar program that providers, MDs, and RNs, nurses, can get CMEs for. And that will be launching sometime this spring. I believe we're thinking the last week of February, and it'll be a 4-week long webinar series with a 1-hour weekly session. And so are mostly focusing just on providers. Other states have seen increases in testing when they focus on providers and not just on community members and families. And so we're hoping to focus on providers to let them know the importance of testing, specifically Medicaid children or at-risk children for lead poisoning. We've been doing different outreach campaigns. Obviously, we're still outreaching to families. It's just not going to be a primary focus. We do soil shops. So we'll come to a community and we'll test soil for community members. They have to dig up the soil, let it dry. We use an XRF machine that can read lead levels in soil. And if we find that their soil has high lead levels, we provide health education and different resources for them to help mitigate that exposure to lead in their soil. And we've been collaborating a lot more with EPA to try and do a whole government approach so that we are all communicating the same information across the board. And so to go back to that recall, again, highlighting the importance of lead testing. This initial issue was found in North Carolina. A child tested high for lead. Someone in North Carolina was able to go into the child's home. They couldn't find the lead exposure source. It wasn't in the paint. It wasn't in the usual places. And so the lead risk assessor started asking about foods that they were consuming, and found that this child had been consuming a lot of this Wanna apple cinnamon baby food. And so North Carolina had the baby food tested, and it came back high for lead. And this helped trigger this nationwide voluntary recall for several brands of cinnamon apple baby food. And so we in Colorado have only seen one suspected case of elevated blood lead due to what we think is the food. The food was not in the home at the time the investigation happened, so we're not entirely sure that's what it was, but there were no other sources of lead found in the home. So we're assuming that it was related to this recall. And because we don't have the resources to do more in-home investigations, it's possible that more children have been exposed to lead through these apple sauce pouches. It was only sold in Dollar Tree stores, and so it wasn't distributed widely to multiple large stores. Thankfully, it was just Dollar Tree stores, but there's still that concern that families had been feeding this to their children. It should be off of all Dollar Tree store shelves. And we have somebody here on our manufactured food programs going into Dollar Tree stores to make sure that this is actually the case, because it has been requested to us by the FDA to make sure that this food is no longer on shelves, because apparently in some other states it was still on the shelf even after the recall. So we're trying to make sure that we're doing our due diligence to make sure that this is not on food shelves anymore. So just one example of a recent recall. We get product recalls all the time for lead paint. We don't get a lot for food. So this is just kind of one of those outliers, but it does still exist. And so what are we doing to address all of the gaps that I just mentioned? The low testing rates, the inability to do in-home investigations. We are requesting through CDPHE's budget that's now with the legislature, $1.2 million to help us address these gaps. The low testing rates, ensuring that counties like Custer County have access to lead testing machines. We will be providing those machines to areas that we are finding that have the highest exposure risk and the lowest testing rates to ensure that these kiddos are getting lead tests. This includes also outreach and education to the providers in those areas to ensure that they understand the importance of lead testing. It's not a historical problem. It is still something that is around today. And that it's really important to know if a child has lead testing, or lead poisoning is the only thing you can do is do a lead test. And that's, again, how we find out about all of these different exposures and how recalls happen is that we don't test, we don't know, and thousands of children can continue to be exposed to lead. It also is giving us the ability to do in-home investigations for every single county in the state. We would be hiring those FTE at CDPHE and deploying those folks out to regions, and we would be doing lead investigations in all homes for all lead exposed children, not just 10 micrograms per deciliter or above, but any child with a blood lead level of 3.5 micrograms per deciliter and above. So we're really hoping that this budget goes through to help us address the gaps, because we realize that counties are under-resourced. Physicians may not have the tools like the lead care 2 machines or the knowledge to know that lead still is a concern here in Colorado and nationwide. So fingers crossed, there is a QR code here if you want to read the budget request. If you want, I can also send a link to the budget request in the chat here in a second so that you guys can look at it. But it's been made public. Like I said, it's at the legislature now, so we should be hearing at some point soon whether or not we will receive funding and how much that funding will be for.
$1.2 million enough?
Say that again?
$1.2 million enough?
1.2 million, yes.
You'd be happy with that.
Yes, then we'd be able to do all of the things that we requested in our budget request.
I have a quick question. This is Kevin Day. Kind of going back where you hit on the soils. So does lead typically show up by itself, or does it typically show up with other elements or minerals or something like that as a norm?
It could be both, then could be one or the other. And it's hard to say. When we do lead testing in soils, we can't say where it's coming from. We don't have the lab doesn't have the ability to do that. What they'd have to do is separate the isotopes to identify where it's coming from. So we don't know. There are factors where we could essentially say, okay, well, you don't live near a lead smelter, you don't live near a historic mining site, you don't live near an airport, you know what I mean, that we could say, okay, these are not an issue, so it's probably just part of the natural geology of the area that you're living in. But say you live in Pueblo, Colorado, the lead smelter, you live within a certain amount of miles from that, it's likely could be from the lead smelter, although that I think it's a Superfund site that should have been cleaned up. But those are the things we look at, but it's hard for us to say specifically in soil where it's coming from.
Okay, yeah, I didn't know because, Colorado's naturally on decomposed granite and things of that nature, so we tend to have a lot of radon issues. So I didn't know if there was any kind of a correlation or something like that between the things of that nature.
Yeah, there are areas where that is a concern, that it's probably just part of the natural geology, but when you've got multiple variables playing into that, we just don't know for sure.
Yeah, thank you.
Anyone else have any other questions? It was a lot of information. Sorry, I feel like I threw a lot out there, but I wanted to make sure y'all had the full picture.
I don't have any more. Anybody else here? Well, thank you, Megan, very much. Sorry for the delay hassle getting to you, but I'm glad we got it.
Oh gosh, no, I think it was just a miscommunication, and I appreciate y'all still giving me an opportunity to chat with you, even though I was late.
We were a little late starting ourselves, so.
You helped us out, actually.
Let me stop sharing my screen. Well, thank you all.
All right, who's up next?
Thank you, Megan.
Time for Dorothy.
Thank you, Megan.
You ready for Dorothy to talk there, Doc?
No,
Oh, you got
Sarah
more?
had not
Sarah,
finished.
Sarah's got
She was
more?
kind of in the middle.
Oh, I didn't realize you were in the middle. Thank you. Reminded me.
Alrighty, so I'm also going to present on our maternal child health updates. Deb, who's in charge of that role, is not available today, so I tap in quite a bit. And so we have formed a well child assessment with a form, and this is what it looks like. And so children that come in for their regular scheduled vaccinations will get reviewed and referred for services at the time of appointment. So this just helps us kind of keep track of where they're at, what they need, and what we can do to help. We've also started oxygen testing for our newborns, because what can happen is we don't have a hospital up here at our elevation. They have to deliver in Salida, Canyon, or Pueblo, which is obviously at lower elevation. And what can happen is when the child is brought back home, they can struggle with eating and growing because their cardiac output can be stressed so much at altitude. And so we want to make sure that they adjust well and that they can grow and proceed healthily with this oxygen testing. And so it's very simple. What we do is we have a machine called an oximeter, and it attaches
You
to their
prick
heel.
them, you poke them.
Nope, don't have to poke them
No
actually
needles.
this time. So, no, it's a painless test, and we try to get it while they're sleeping, so that we don't get
Like
abnormal
a finger
fluids.
oximeter that.
Exactly, yep, it goes on their heel or their wrist, and what we like to do is to make sure that their oxygen levels gives us a percentage and their heart rate at the time of
What's good,
testing.
90 and above, or?
Oh, higher than 90. I like to see at least 97. And so if they would kind of score, and we'll watch them for a good 5 minutes to make sure that it's not just a false read, and that they are truly able to compensate at this level. And we actually got to perform our first one on a baby a couple of weeks ago, and the baby passed. So that was excellent. But we're really trying to advertise and bring that, awareness that this is an issue, because when they leave the hospital, parents don't think about, they're tired, they're exhausted, they're coming home with their baby. And it's just something that they don't think about. And so if this child continues to cry or does not feed well, those are signs to us when they come in for a visit. Hey, we need to check out and make sure that your heart is.
What do you do if it's bad?
We would refer to a physician
You
immediately.
need to take them down below right away, or?
Yeah, and they have further testing. They can do what's called an echocardiogram in their heart.
Can we do it up here or not?
I don't believe we have the capability of doing that at our current.
Medical center,
Resources.
medical clinic.
I think so, yeah, they would probably have to refer to their pediatrician. And so what we can do is write up a form. This is what we did. This is our elevation, date and time of testing, and give that to the parents so they can bring it to their provider.
Okay.
So
So we're trying to develop with using the form that you passed around there. Basically, we have no records from any years previous. What the various health risks are here. I mean, nothing has been documented. So we're trying to start with all of our kids, with all of our adults, with everybody, to document what we find: blood pressure, oximetry readings.
So you don't wanna cry wolf, you don't wanna
Right.
wait, so what's your threshold? You don't wanna scare a parent saying, better get them down there now.
Well-
What, have you figured out what you're gonna do, how you talk to them?
So usually we have these evaluations on a weekday, and so that way if we run into complications, that they can go and seek. And I mean, usually most
Yeah, but
pediatricians,
when would you recommend that? At
Oh,
some
as soon as
oxygen
possible.
level, or?
as soon as possible,
What-
just to make sure.
Yeah, I get that, I'm wondering what level.
At what reading?
What readings would you, what you got a plan for what you're gonna do at certain readings?
100.
Yes, so
You'd
I really like to see them at least 95. Anything below 95, that would cause
Say
me
head to
concern.
foot.
Correct.
Okay.
Just to make sure, because sometimes too, there's a heart valve when baby is in mom.
Yes, washing through.
Correct. We want to make sure that closes, and they do a test before they go home from the hospital to make sure. But then again, altitude can cause stress,
Okay.
things can happen,
Cool.
and so that's
Okay, good.
why we do what we do. And
So can
then
I make one comment here, since you guys are asking? This is the person who takes care of adults predominantly. Those readings would be different in the elderly population
yes.
than what you would see in small children.
Yeah,
Yeah, at your age, 90 is a good number.
That would be
that's why I use it. I can run a 7-minute mile at 90.
Glad you said it.
But yes, very good point. Thank you, Peggy. Deb has recently completed her certified lactation consultant certification, which is excellent. And so now she can provide breastfeeding support to local families. I will begin training hopefully in the next year. And so then we will have 5-day-a-week coverage, which is wonderful because it's hard. I've actually consulted previously for a family here in the Valley that was sent home by a hospital in Pueblo. And they had no resources, and that baby struggled with breastfeeding and ended up stopping breastfeeding, which
That's
was
too bad.
very, very sad.
Yeah.
And so we're hoping to reduce that risk for our future families here. Deb is also taking courses on perinatal mental health and focusing on outreaching into like Lighthouse and providing services there. We can also team up with Sylvista and make sure that things like postpartum depression, especially being in such an isolated community, puts people at high risk because we do not live on top of each other here. And resources can be hard to find. And so we want to make sure that we give these new parents access to that. Child immunization data. So there is a special little chart back into your vaccine data here about child immunizations. We performed 86 total in 2022. This year, we're at 91, and actually I had a kiddo come in today, so we're at 92 for 2023. So we're holding very steady and actually seeing an increase, which I attribute to us being more in the community and teaching those, what we do at public health. And that you don't have to go down the hill for your child's vaccinations. That seems to be a good time saver. So there's also WIC is Women, Infants, and Children. That's a resource that our UCOG provides us with. So there is WIC data. I don't know if you guys got a copy of this. If not, we'll go through it real fast. It's only a couple of pages. So we have in Custer County 52 participants, which is pretty good. Compared to Lake County, that's the closest that we have in comparison. We're servicing fairly well, so I'll pass that around so you guys can look at that.
You guys know what WIC is?
Women, infants, and children.
Yes, and so they educate on nutrition, they do weights, which we also do weights, and we work in.
Women, infants, and children.
She even said it.
Yes, and our representative Jessica is fantastic, and she has started seeing people in person, which is wonderful, and we're hoping she sees them once a month. Here in Custer County, she's trying to get it to at least twice a month here, and so budget pending. But she really does go above and beyond, and we really appreciate working with her.
Above and beyond, the state just put it onto a new corporation. And they said, well, you have to have at least 50,000 kids that come in or we won't service you. That's children. We don't even have 5,000.
Yeah.
We
5,000.
We got like
we don't have
500.
5,000, yeah. So, but Jennifer has bent over backwards just to service. She said, I will not let Custer County go without care.
She's fantastic. We're even having discussions about her coming to playgroup and discussing, what WIC is, who qualifies, how we can get more people connected with these services.
And I believe, yeah, there are one of the discussions at COG is happening to partner with a couple of other COGs to get those numbers. And then the discussion is which county is going to be administering and everything else. So yeah, that's been a discussion at the COG.
Good. Excellent. And then lastly, we participated in the Family Fun Night most recently at school, and Dr. Brown and I got to go and promote our family focused services and have actually recruited a couple of families to come in, which is fantastic. So we're going to keep on working on community outreach, especially in our young families, because they can grow with us. So, and it sounds like from what our presenter said, lead testing may be one of those areas we need to focus on. And we have a great kids council, which I'm a part of, and they would be a great networking tool to try to increase testing levels in our children. So we could even host an event at the library to try to educate about that and see about resources and testing kits. So thank you so much.
Thank you.
Is there soil sample data we could get from the state or from whoever? I mean, everybody's done a little drilling, done a little whatever. That data has been, there's so much data that's already been collected. That's been done.
You weren't on the board yet, but last year at this time, we had a state program, a research program. We was going through and checking particularly for uranium relative radiation. And we came out smelling like a rose, not smelling. Okay, so we're doing really well. But has there been everything checked? Absolutely not.
No, and probably the national forest has been checked, right? So the Sangre is where there used to be mines like that. I mean, not that any of us spend a whole lot of time up there, but
No, there is not.
Okay.
Not a big report.
Was that the well water
Yes.
program that they did
Yes.
last year?
Okay, a lot of these things that I wanted to mention, there's one more kind of that handles young mothers and fathers.
We did. I didn't see it. I'm sorry.
And we have had so far a couple of people asking us, and that's for sexually transmitted disease testing. And this is done anonymously as far as anybody else. They're provided a packet. They can fill out the forms, and we will help them they can come in and we will help them do their own tests. Then that's sent in, and then they're provided a number by computer. And so they can access, nobody else can access their information. But if they are positive, if they test positive, and we've had some concerned people here, then the state will actually help them get the program, the treatment program set up for them, once again, without telling other people. Okay, so I expect that there will be more tests as the word kind of gets around. I don't want to advertise over the radio for this, you know, it needs to be kind of word of mouth.
Okay, time out for a second. I didn't see it because the chat was off on mine, but Jordan Hedberg, Jordan, are you there? You had a question, I think.
It wasn't a question, it was just to Lucas's point, which is, and I'll try to pull it up, but there has been some studies done on the dirt roads here because we used to use a lot of gravel from the silver minings back in the 60s and 70s that caused a lot of lead issues. So mostly from the LC camp area. And then somebody else mentioned there is that test that we should have the results from with the, I think it's the state geological service that did a well testing for each grid in Custer County. So we should see results on that. I keep waiting for the release, so hopefully soon.
That's good. Good point. Thanks for bringing it up.
Thank you, Jordan.
Yeah, there was another gentleman, an engineer, and myself who were assigned to test wells in various portions of the county. And that was all done, and then the results were delivered back to the individual well owners. But there was nothing, there was no area, there was no well that was positive when she talked to me as far as our results were concerned. Okay, we've gone through the vaccines, we've gone through the testing. I showed you the little graphs. You can see that there's, as you get along over to the right side of the graph, it's pretty well staying the same for quite a while. So we're doing well as far as the number of people. We have had no outbreaks. I still don't trust the data totally because people aren't saying when they get tested, they aren't giving any results. So they stay home, or they may talk to their next door neighbor and the cat, but it's not something that they're reporting back to the state. And we haven't had much in the way of state reported illness. That's RSV, COVID, or the flu. Or the people who are sick, absolutely.
Yeah.
Okay, infectious disease. Because we have about a third, 33.4 from particular stats I saw, who are 60 and above. These people not only have a reduced ability to fight off disease, but when they have other illnesses going on at the same time, it really can drop them low. So it puts them at high risk. But we have had no RSV vaccines really delivered to us. We have a few, we have some people who want it, and we are starting to do it, but it's on specific order because of the expense. Kids aren't $250. Kids who are the real potential victims, it's like 565, something
And
like
there's a
that.
national shortage that,
Yeah,
so
you can't even get it.
we've chosen not to vaccinate children at this time because of the high cost. And they really are trying to hire all of the RSVs to the hospitals and trying to hit the newborns, which are at greatest risk.
So it saves the parents money if the woman is pregnant, as long as she has it 14 days, as long as she has the test 14 days before pregnancy is finished, you know, the child is delivered, then it only costs them 250 instead of 565. So we're trying to, with our other programs with pregnant women, trying to get them advised so that they are taken care of when it costs them less than half as much.
Sure.
So just a comment. That's how we're trying to do it. We have, I went through all of what is available to us with the pickups, with the vans, with the buses and so on. And we have potentially, if we do have an emergency, we have transportation assets that will handle 272 passengers. If we had to get the heck out of Dodge, had to get them out of the valley, there's a big fire, there's a big something.
Prioritized by need.
Yes, be prioritized. Usually it'd be pregnant women, but the first ones would be our seniors. And then we fit in. A lot of people can get rides with their neighbor or whatever to get out, but we just have to be ready in case.
And so you don't want to overlap either. So if a neighbor grabs somebody, it's on your list and you waste a
That's
trip
right.
up.
Yeah, that's why
You
we
got that
want all
figured out.
these points on the
Okay.
map. So we have points of contact, plus we have the actual physical
Okay, good.
locations. And those are being worked out with our sheriff's department, so we can maintain secrecy,
Mhm.
security, privacy, whatever you want to say. Okay, other than that. Anything else that you guys have any questions about? Our infectious disease reporting seems to be from all the numbers we can get back in and from testing that's being done, research studies have been done around the world, not just the US. The US, there seems to be still a pretty heavy penalty for a lot of the docs if they start saying anything that's out of the kind of canned response relative to COVID. So it's still tough, but there are some reasonably well-known international pathologists, internal medicine people who are looking at these things carefully. And you've all heard, I think, of the athletes, the international level athletes dropping over dead or showing up dead between 2 and 3 in the morning. And a lot of this appears to be, from what we know so far, potential for a couple things, but the basic cause is an inflammatory response precipitated by the actual COVID spikes, the spike proteins themselves. And so once you start to irritate the inner linings of the blood vessels, you have all sorts of not only potentially vascular disease, and they have a long, it's like a white, and it can be feet long clot that can form inside. It's not like the regular red blood clots that we have.
White blood cell.
Yeah, that's a white blood cell thing. So we have that, plus we have individual cells scattered throughout the heart muscle, the cardiac tissue, that die. And once that happens, then they can also start to interfere, and you literally can stop the heart because of response of the heart tissue. So it's a very serious thing, and more numbers are coming out that are talking to us and saying, okay, these people within 10 to 15 days after receiving the vaccine had a serious problem, they died. So anyway, nobody has a complete list or answer on this yet, but it is more and more information is coming out, which is what we need. One of the interesting things I read here in the last week was the publication, the fact that there were literally 23 people tested on Pfizer's booster vaccine before it was
Or they
actually
released it.
before the
Wow.
before the FDA gave approval. So anyway, once again, lots of information here, but just
Heads up.
keep watching and be careful. If you have any sudden changes in the way you're feeling, please check with your physician.
Got it.
Questions, gentlemen?
I'm good, thanks. Anything, Kevin? More? Lucas?
If you could, what's the most important thing that you feel public health needs to focus on in Custer County?
It's the bivalent. It's the really young children and pregnant moms.
Mhm.
And then our elderly, because our kids are basically healthy. You know, they don't really get terribly sick with COVID and, you know, on and on. Most kids don't even know when they have it. And that's not 100%, right? It's most. And then we get into, once again, what I had mentioned relative to our elderly, like moi, where you have other things going on. You don't have as much resistance, ability to respond effectively to fight off disease. And so when you have an additional 1 or 2 or 3 or 4 or 5 or whatever ailments going on in the body, malfunctions where things are kind of holding their own, but then they get that kick when they're down. Those are people that I'm very concerned about.
Thank you.
So we're trying to, and I think I mentioned this before, in the long-term community action plan committee, we're trying to, tossing around at least, develop housing that is right here in town so that people don't have to leave the valley, but they could still have a place here in town where they could be close at least 2 or 3 days a week, perhaps more, and still go back out to the ranch and enjoy life. But those are the two answers to the question.
Okay, thank you.
We have the exceptions, of course, where somebody has a long-term or something they were born with condition, disabled, and they can be any age.
Yeah. Okay.
Kevin, anything from you?
I had something briefly a minute ago, but it's gone now. So if it comes back, I'll holler. Give it a check.
It's the second thing that goes.
I'm there. That's why I was allowed to make that comment about you a while ago.
Gentlemen, I would like to ask a question. You guys are very involved in the community. What do you three individually see as the most important health need in this county?
I think, I know a lot of people that I know personally leave for Texas and Florida come winter time.
Right.
Because they go from walking outside. And yeah, they do swim at Altitude Fitness. We don't have a place like Colorado Springs or where there's more people now, especially of the more mature generation, who walk the mall or have a big area to walk in. And so they go, I want to be able to go outside my house. I don't want to be closed up for 3-4 months. And I see it as a two-pronged thing. One, I want to keep those people here spending money. And we see this huge decrease in our citizens come wintertime because they do go to lower elevations. They do go to where it's warmer and so and then those that do get bottled up, they just sit there and they don't get fresh air, they don't get sunlight, they don't get right and exercise and I'm kind of the same way too. So that's what I see is
So indoor walking areas, outdoor walking areas?
more indoor because they don't want to, it's the wind. It's
Yeah.
not so much the cold, it's the wind we get from the 1st of February and then
And that can precipitate cardiac and strokes and respiratory events, walking in that kind of wind.
so that's what I see.
So indoor walking is okay.
Thank you.
You?
I've seen you pointing at me.
Yes. Exactly.
And I think Dr. Brown would say that this is something that I was pushing for when we didn't have it, and now it's gone again. I really appreciated the health fair because it gave a lot of people an opportunity to go and get some of those basic health checks. And it was all in one place, and it was a good community outreach at the same time. And so I am sad to see that disappearing again, although I thank you for setting something up through the library. Will that be as effective? Time will tell on that. So, but where we could go in and we could do the blood draw, we can and get a lot of these other deals where they did not have to go down the mountain and do these physicals and things down there. So that was one thing I really appreciated.
So I did coordinate the health fair this past year, and I did notice a big difference compared to when we had our last one in like 2019 in attendance. One big change that has happened between now and then that may have impacted that is laboratories are now allowing people to order and pay for their own lab work. And so if you wanted to have a CBC or a CMP or any of these kind of labs done, you can go online and order it through LabCorp or Quest or whatever lab you are affiliated with and pay your money and go get it done. And so that was one of the advantages the healthcare offered in the past is you didn't have to see a provider, a doctor to get lab work done. But that's pretty much true anywhere. Anybody can get lab work done now without seeing a doctor and just have the results sent back to your email.
As usual, as long as you.
Yeah, and
Right,
Kinda
if
to
you
that
pay the
point.
money.
to participate in it up here actually cost me more money than if I went to the doctor and he
Right.
ordered it through LabCorp, because by the time my copay at LabCorp was like $7 and something like that. And then the $35 copay. And so, you know, it actually cost me more to do it here, but I did it because it was I don't know, I'm sad to see it go because it was a good outreach to the people and was a good benefit to them. And,
There's no grant that I found.
yeah,
Could be there.
and I understand that. So, you know, I'm not saying it has to be here. I'm just commenting I hate to see that go by the wayside again.
If we can, we'll finagle something.
So,
Okay, and we'll move on here. Yes, I think one of the big things with marijuana being in here, in the state and our population of veterans that are bigger than anybody else and bigger, most in the state, actually, and our VSO officers making sure we're gonna keep that because he's reaching out to everybody. I think depression and suicide is a big deal. And I talked to Dr. Brown about it the other day, because of the economy and other things that look hopeless. People get depressed, and I see more of that myself. I've seen it around here. And so I think you guys have a golden opportunity because you guys get around and you ought to team up with the VSO and not just him, but each commander, the American Legion and the VFW, get with them. They know where their guys are. They know where there are people that are afraid to come to town. They don't want to come to town. They want to stay away. But there's opportunity, I think, and Cliff's got a military background and you guys are there to help. I mean, go in there unobtrusive. You don't go in there with lights blazing and sirens on. You go in there and so can I help you?
Well, and that was one of the things we saw with the health fair as well is Sol Vista
Right.
had a table and.
Right, but tape even that, you're not gonna get a recluse out of Colonel Verde or out east in the hills or they're hiding out. I don't mean hiding out, they just don't want to be left alone. But they get depressed. And other people that are, I mean, it's the ones that are brave enough to come to town, not want to talk, they're probably the exception.
And if you have principal contact, we'll get in touch with the VSO for sure, but we would be open to that.
And the American Legion.
And the American.
Yeah, I have spoken with him and.
Yeah, I know.
He's just so picking busy.
Yeah, but the VSO or the American Legion. Yeah, VSO is really busy and he's really good at finding money for the veterans and to help them on these kinds of things too. But I sure would get with those two commanders and make them, have them help you.
On Monday, I went up to the Rocky Mountain VA Medical Center and picked up the information that we have been very frustrated that it wasn't being given to us over the phone. We just got passed from phone to phone to phone. And anyway, I now have the kind of pipeline on how to get into the preferred provider.
Right. And it doesn't have to be, that's good. Doesn't have to be vets either because COVID wiped out a bunch of businesses. People died, people got depressed, it was bad.
Well, and even just our climate, we have about 3 months out of the year.
Yeah, it gets depressing when it's winter. There's a month of summer and the rest of the year is winter.
Yes.
It feels like. Dorothy, you have sanitarian, anything to bring on?
I just have an update. This past month, we've had 3 septic systems installed
based on our efforts, sending out notices, talking
Good.
to people. One septic system permit that Dr. Brown and I went out and served a cease and desist order on. That lady has come in, her contractors pulled the permit and they have it scheduled this spring. And I did forward one issue to Dan Slater yesterday, and he has replied. He's working on action going forward.
Good.
This person, and we've been trying to get to install a septic or do something since March. I've been giving them verbal okays to do certain things, and they just have not been following up with their end.
That happens, and we've in the past had a contractor volunteer to put a septic system in and go do it for free, and you know, people, it takes a lot to push them sometimes.
Yeah.
Well, good, thanks. Anything else, anybody?
I have my proposed change.
That's what I want.
Oh, okay.
She did find them.
Yeah, okay.
I
Now,
want you to forget me.
no, I'm not forgetting, that's why I asked you from a sanitarian point of view, so go ahead. She's got some changes here.
Well, if you guys want to stay through this whole thing. I should have,
No, you had to listen to them.
I should have tagged the pages, so I tried to kind of
I'll go again.
put a paper clip there to show you where
Oh,
I'll be going from section to section. Hopefully that's helpful,
So-
and by all means, this is a very rough draft.
okay, speak up, because nobody online can, there's a few
I
of
think
them.
originally I told you guys this is a very rough draft. It was kind of me looking at what we had currently, our outs.
Thanks, guys.
Regulations have not been updated since 2008. Is the point to note. Another point that I want to make here as we go through these suggestions is that one of the things in this document talks about the fact that Colorado Department of Health publication guidelines on this particular document. We will abide by all them unless our regulations are more stringent. So I know there was some issues on the Kemple toilet, and I understand where you guys are coming from, but that's a state regulation. And I thought I brought copies of that in case that was a topic that I don't see that I have them after running. Oh, yeah, I do. No, after running back and forth, I think I ended up leaving them over there. But to start off, the first change that I'm gonna suggest is on section 200 definitions is the definition of county use tax. And I'd like to just suggest that we make this area consistent with what we're putting in the current resolution. So we do the county use tax on building materials. It would be the same for the building materials for septic systems. It's just not written that way in here. So I'm just suggesting that
It
we
seems like
change the
building
verbiage.
materials mean it, I would think it would.
And if we don't want to charge the use tax on the septic, because I'll tell you, I get pushed back from the septic contractors more than I do anything. So a lot of them buy them in bulk, buy the
Yeah.
items in bulk. They get a discount and it's really tough for them.
Yeah.
I am open to whatever you guys suggest. I'm just, if we're gonna keep that in here, I would like to make it consistent with what we're currently doing.
Sure, and so we're not making a decision on that, you're just pointing out what's coming up in the hearing you're gonna have, right? Just the request.
I don't know that do we have to have a hearing for this? I didn't read that way.
This is, you're trying to propose the OWATS treatment. I think it should be at least a
Okay.
public meeting
Okay,
that we want to hit those. That's what we've done in the past, but it's been a long time. Give us time to take a look at it. That's what I do. I mean, just, you can come back next
so
meeting.
today, just discuss what we're
Yeah.
what we're talking about, what our suggestions are.
And if it's simple, we can agree, and if it doesn't need to be,
Yeah.
that's fine.
Perfect.
Let me comment if I may. The way I read the regulations, if you have a septic field,
Mhm.
you know, all set up, bathrooms, so on, and you want to put in a chemical toilet, that is not against the law.
Right,
It's if you have only.
only a
the
chemical toilet,
chemical
that's
toilet.
true,
Just wanted to bring that up.
okay.
Down on the definition of the individual sewage.
So give us a
disposal
page
system,
number.
it's on the same page, Bill. On
Section
the
2 at the bottom.
section 2 definitions
Oh, okay.
at the very bottom.
I got
I just want
This
to
guy here.
remove where it has examples
sure.
include. It's talking about the septic systems. I'd like to remove where it talks about the examples. Where specifically, but are not limited to chemical portable toilets, composting toilets. Just so we're consistent with what we're changing.
Yeah, I don't have a problem with that.
So the next section, I tried that.
That's a good one.
I tried to section them out for you guys. The next section is section 3, administrative. We have made the change on our applications for a septic system to only allow contractors to come in and pull the septic permits. And the reason for that was we had a couple instances where a homeowner would come in and pull that, or an individual would come in and pull it for a landowner. And then before we knew it, they were putting a septic system in themselves. So they would put a contractor's name down, and then that contractor, when I went to contact them about inspection, I discovered that they were not the ones who put the system in. So it's worked great. The contractors are very happy about that change. In that way, they feel like that's their license. They don't want somebody else.
They don't,
operating.
that doesn't preclude a homeowner coming in and taking the test and doing it.
No, sir,
So
not at all.
there's no reason why that
They'd
isn't a
be a
good thing.
contractor at that point.
Yeah, well, they would be,
Well, we're gonna
they'd be
talk-
certified at that point.
They'd be
Not-
Talk about that
Yeah.
a little
So if a homeowner can't dig their own, put their stuff together and have a contractor look at it and go, yeah, that's installed correctly.
No, they can make it, they can't, they can do it if they know what they're doing, but they can ask a contractor to do it. And if if they work, I mean, they have to meet the criteria, and if the contractors give them the advice, then it's his license, it's his deal.
Let me kind of explain the process. So I'm a homeowner. And my first step before I even get my building permit, let me say this correctly, my dwelling. Is to put in a septic system. But prior to that, they have to do a soil analysis so that we can tell them how many infiltrators to put in, or how large the bed needs to be, depending on how the contractor is gonna put it in. So it's usually 2 different contractors that are involved, the soil analysis contractor and the septic installer. So at that point, once that is done and that permit's pulled, then they're able to start pulling their dwelling permit and everything, and they're ready to go. But like I said, what we're running into, we're not allowing the homeowners to come in and pull their own septic application.
Doesn't mean you can't dig it and
No.
do it. And then if you're getting a licensed guy come in and tell you, it's under his license then.
Right.
But then he can get the permit.
Okay,
So it's not, doesn't stop you from helping. Doesn't-
just like you could do with a plumber
Or
or an
electric.
electrician.
Yeah,
right?
same as
Okay.
electric.
All right.
So, okay, did that answer your question?
Yeah, if we were telling homeowners you can't dig your own stuff, you can't buy your own stuff and put it in, I was gonna have a major.
Well, they can as long as they test and they pass the test. That's how.
Yeah, By
Yeah.
himself, but he's saying but he could go and do that under the tutelage of a licensed guy. And the licensed guy is the permit.
If they choose to.
That's right.
I
They can
guess.
do that if the contractor wants to have him do that. In some cases, that's not a bad idea if a guy's got a lot to do. And so he can do that.
Electrical, you can do that, you can
Sure.
pull your own permit,
Sure.
you can do your own work, you can call the
Yeah.
inspector out.
Yeah.
He comes out, goes,
But
yes,
that's
that
the
looks all
point,
good. He goes,
calling the inspector out even for.
See,
this.
that's so this is, all this is, he becomes the inspector then. You see what I'm saying? Contractor.
Well,
is-
We're saying, but we're saying that you have to be licensed.
No,
If you wanted to do.
if you
your
want to do
own
everything by
fire,
yourself.
Right,
But you're saying you just use the same thing as the electrical thing. You're
No,
getting an
well,
inspector at the end. The
but I-
inspector happens to be the contractor that's licensed in this case. You just said if the guy could come out and look at it and certify it.
yeah, but that's an inspector, right?
No, it's the contractor.
So
You
if a
asked-
homeowner out there wanted to do their own electrical,
Yeah.
and some have,
Mhm.
and they put the permit in with the
Yeah.
state.
Yeah.
They do their electrical, the
Mhm.
inspector comes out, inspects it, passes it all, and it
Right,
moves
and
on.
it's on his
right?
deal, his
It's
license.
on the homeowner. It's on the
I
homeowner,
know homeowner did it, but.
because the homeowner doesn't have a license.
That's right, but he's certifying it meets what a guy did. This is the same case with this septic system. You do all the work, you can put the infiltrator fills in as long as it's following the criteria and meeting just the same as an
But you gotta
electric.
hire a
You're gonna
contractor to
hire-
pull their permit.
But see, that in effect becomes the inspector for it. See, just like your difference is the state is already paying a guy to be that inspector.
So you don't go out and inspect
Dorothy's
after
the
the.
inspector,
I
not
do.
the contractor.
Yes.
Okay, so there is
Process
two
for a
steps.
homeowner.
Yes,
There's a process for a homeowner if they want to do their own septic.
Sure, I'd like
They
to do
come
mine.
in- They come in and
You
do,
have to pay Bill to do it.
they come in,
but I'll
they
do
come
it for
in
you.
and take the contractor's test.
Okay, so they have to take a test.
Yes,
Okay.
so they,
I think,
If they want to do it by themselves.
correct me if I'm wrong here, and I believe that's due in part because of the health regulations. It's where you,
Gotta
is
follow.
why
No, I.
on that, but,
So I'll give you a real example. You could say, I'm gonna go watch me do it the whole time. And as long as, and I'll put the level on it, same thing that Dorothy does when she certifies it.
Mhm.
I could pull the permit, whatever it costs for you, and I could say, I'm just doing it for you. And, you know, you're hiring me to be the inspector basically, because I'm certified.
Right.
And
Okay.
you can do that. It's as long as it meets the criteria and it passes her inspection in the end.
how much is your test?
$75.
So if you wanted to do it by yourself without hiring Bill, it would.
You can do it.
tell you coming in
So that means I can't charge you more than
$75.
75 or it's not worth your time. But you have to
Didn't
take
have
the time
be
to
your
take the
question.
test.
That doesn't count for all the time that you have to study.
Sure.
It's not an easy test.
Yeah.
We'll talk about that a little bit too.
All right. I got
Okay.
you.
The, on section 3 administrative, just some minor changes because we did make that change. On A, just take out homeowner or agent and put in Custer County certified contractor. Same thing on bullet point H, take out the applicant and put in Custer County certified septic contractor. Simple changes. The next section
Yeah.
is 8.3 chemical and portable toilets. That since the state has changed that guideline, we have not made those changes in our regulations. So I would like to make those changes on number 1, just have that bullet point say only during construction under emergency circumstances. And take out the section where it says or for occasional camping. I think we probably need to put a little bit more verbiage in there. But if they have a self-contained unit in their camper, that's fine, that's occasional camping. If you're in the tent camp, I mean, I guess I'm up to debate on whether we leave that in there. The reason why I wanted to remove it was because we have individuals who are building full-blown cabins and not connecting them to septic systems. And then having say they just use a portable toilet. I have no way to validate that. So I think we need to, if you can come up into Custer County and own a second cabin, you can afford to put in a full septic system. The one we went out and looked at, Dr. Brown, was what, a $700,000 cabin? And did not have a septic.
Nothing. They had a cutout in a 2x12. Open pit. They had no enclosure around it, and you spend
Really?
$600,000 for your house,
That's kind of crazy.
and you don't have a bathroom.
Let's see, number 4, the superstructure surrounding, we can remove that. If we remove 1, we can remove number 4, basically saying that it has to have a structure around it. 8.4 incinerator and composting toilets, I would just ask that we remove that whole section. And then add in there in place of it.
Well, hold on a second, because. Before you
It's covering the incinerating and composting toilets. what the regulations
Right.
are for those.
I'm just gonna.
So if we could remove what's highlighted in yellow and put acceptable only when there is no other option for installing an out system. An outs variance must be applied for and approved prior to installation and use.
That's what you want to put in place of
Yes.
4.
In place of that would be. all of
8.4.
8.4, yes, sir.
Okay, well, we haven't got what your words are. You just told us what they are. I'm just,
It's in red down below.
oh, it's down there. Okay, didn't tie it in there. Okay. I'm gonna make a note. Anyway, my question is, it's acceptable to have a chemical toilet if you got a septic system too, so I would think you'd still want to say if you got a chemical toilet, you want to have it be private and vermin free. So why wouldn't you keep that in there for that situation or specify that?
Yeah, we can keep that there.
To me, you know,
And you want to meet the state.
you gotta meet the state
standards.
criteria, and if the state says you can have a chemical toilet, you want to make it meet the right criteria for a chemical toilet.
So if there was a variance approved,
Variance approved, or why did, I don't even know why anybody would want a chemical toilet and a septic system, but that's, people are strange.
Different part of their houses.
Yeah, can't plumb it around, maybe they add an addition on. That's fine, so you gotta make sure the chemical toilet is still compliant, that's all.
so leave 4 in there. We're up at the top again. is that
Yeah,
correct?
uh,
Okay, so 8.3, we're gonna
Sure,
leave 4.
any, yeah, you're assuming they're meeting the criteria that they already have a septic system and you gotta
Yeah.
point that out.
Okay.
For
So leave
those,
4 in there and then put if, leave that in there.
for a
for-
print, it says, for those that are, meet the criteria for ones, you know, that have a septic system already, I don't know,
Upon approval of a
sure,
variance.
whatever. Yeah, some way to say that.
Yeah, that's good.
Did you get your car yet?
Almost.
Okay.
being delivered.
Okay. Thanks, Dorothy. That makes sense.
Marvon.
Oh,
Respond quicker.
poor baby.
Okay, 8.4A.
So all of the highlighted section would be removed and we would just add acceptable
Okay,
only when there is no other option. And they've got
okay.
a
I'll read
variance.
it.
The next page is page 20, section 9. Again, we're just removing homeowner so that it says a septic. I just need to put in there certified Custer County septic contractor.
Or certified homeowner, maybe, huh?
Maybe we need to add that.
But I ought to put that in there because it helps answer.
It's never been in there that way, but that's a good.
Could say it.
Well, if you take, you're a certified contractor at that point.
We're gonna
So-
talk about that.
Maybe, maybe not.
Oh, you're still okay. I stand corrected. You pointed at me and told me that twice. And I'll keep quiet.
So currently, if you go to page 21, I'm looking at PennDOT under county authorization and licensing. For a authorized county tester, percolation technician, we do not necessarily have anything put in writing. I know that it says here that you train underneath the Colorado registered engineer. Submit a letter of that they've supervised you. What I would like to propose, because I know this is not happening, nor has it been happening for if it's ever happened. I would like to propose that in order to be an authorized in Custer County to do perk tests, that you take a test through the state of Colorado. Simple, that's it. They have to show that they've passed that test. All of our current percolation test contractors have taken that test through Colorado Professional Waste Management. So I would just like to say we just change that in here. Somewhere along the line, it got changed because it's not what we've been following. That would allow me to have a certificate on each one of the certified perk technicians. And we could keep track of that and actually issue a license for them.
Well, you don't have to necessarily issue it, you just have, they won't be recognized as a provider, so.
We print out certificate.
You,
for
you
each
can have
one
a
of them,
certificate.
And they like getting that certificate.
Sure, yeah, that's fine. I don't have a problem with that. I'm surprised it had all this other nonsense in there.
Yeah, I think that's probably our best bet to just have them do that. If the,
Does the state allow you to do all these steps though, to begin with? Does, doesn't it?
yes, yep.
So
If
if
they
they did,
take
they can
that
show it.
course,
Right, I
If
mean, it said train
actually-
under Colorado registered engineer, is that,
well, they don't actually train underneath an engineer. They go through a class.
well, that's what I
2
mean,
days.
so where did the word come from in the first place? Is that,
This, what's highlighted in yellow is
Yeah.
what we currently have.
I know, I'm just wondering how they got that in the
I
first place.
don't know.
You don't have any idea?
But
So-
if you take the perk test so that you're authorized to do a soil evaluation, you actually go for 2 days. A portion of it is classroom training and a portion of it is out in the
Yeah.
field. You're testing soil, you're doing the actual work. They teach you exactly what the steps need to be done. What steps need to be done.
Who's the they that does the test?
It's through the Colorado Professional On-Site Waste.
So they come out in a classroom somewhere and then they take you out in the field and show you how to
Yes.
read the soil.
You actually sign up through I call it CPOW, just for the initials of it. The last one was up in Golden. It was, like I said, a 2-day test. It's a rigorous, tough training class to go through. But I like that it's hands-on.
And you say currently all of them that are.
Yep.
In Custer County or have taken that.
Yes,
Yeah, I don't have a problem with that, but I understand what happened here. Engineers, if there's just like a journeyman electrician, that kind of thing. You train under them and you become one, or you could go another way, go through the class and whatever. And I don't think any, if somebody moved in from somewhere else in the state. They may have done something under the supervision of an engineer, might have some of the experience that would be provided in the class. Is the class cost much?
oh, if you're a member of CPOW and if you're taking any of those classes at all, it's worth becoming a member. I believe. I don't know, I can't remember, Bill, I hate to quote an amount. It's
And-
over $100.
And maybe, and by law, by the state law anyway, these steps would still certify it. So maybe there's something that you ought to think about, because if you do get a case, you don't want to just, and then have an argument ensue that says, wait a minute, the state, these rules apply and they still allow me to become a certified soil reader.
I have not seen that in the state regulations, but I will look for that.
See if that, I mean, because they're evidently this is. Has been approved as a procedure, and the state signed off on it somewhere, I would think. So before you, or you could take it on a case by case, somebody walked in and says, I got all this testing, have them prove it.
Yeah.
And if they
Absolutely.
meet the same criteria, then it would be okay, he has to produce all the same documents. You could have this as a sub. Addendum to it, in the event that or something.
Yeah, we can do that.
If you don't wanna force them to take the same thing over again, or if they are certified somewhere else, what do they have proof of that certification? Is they come from another county, they've had the same criteria here.
All of the things listed.
The
there.
class, maybe even the class or even this, we gotta take their certificate and say it's valid, I would think.
Most of the counties are recognizing.
CPAL thing,
CPOW
right,
training.
and you would too.
If you go through all of these steps that we now have on our books, it looks to me like it'd be a lot easier to go take that
Take the
test. and
test.
Come up with
It
all
probably
this,
would.
You
because
might as well
But there
become
may be
a-
somebody,
like you say,
I agree,
you have anybody that has this documentation on file in your
I don't
office.
have.
probably not,
No.
but my point is, rather than arguing with them later. If it does come up, she can look at it and say, you meet the same criteria, then fine. That's all.
Yeah, you have to either do this or you have to do this.
Right. It's just, I wouldn't just I don't think you'll ever have that happen. Tell you the truth.
I haven't, that I know of.
But if it does come.
If an engineer came in and said they wanted to do their own soil test, by all means, they show me their engineer license and I would say, absolutely.
And show them that you've done this before, you know, all the crap. Sure,
Yeah.
okay, all right, good.
Okay, next page. I don't have it on your sheet, but I just wanted to.
Hold on a second. Oh, you're removing it. You're removing the part that says, we have the right to revoke your thing
No, that would be an
after a
ad.
public hearing. Are you adding that C?
She was wanting to remove
The
the
yellow, and she's
yellow.
adding Custer County reserves the right to revoke the
Oh,
authorization.
that one is on every, but on every license, it has different verbiage
Okay,
about us reserving the right to revoke their license.
we always would have that case.
It needs to be on there, but I would like to make it consistent. Whatever verbiage we decide on is fine with me, but it just needs to be consistent throughout the.
So is this
document.
consistent with it on that? Okay.
Sorry, I missed that one. Good. So the next one would be B, letter B on the next page. I didn't put that in there, and I've really been going back and forth with myself on this one. We currently administer a very, very tough test to become a septic contractor. And if you read through this document, there's no difference between me coming in and taking a contract, becoming a contractor and being put on our list, and me being a homeowner and coming and taking the test. There's really no difference. I would like to suggest that we have the contractors, which most of them do. Most of them have already gone and taken a state test or CPAL before they even walk in my door. When they walk in my door, then I tell them, oh, here, by the way, take the state guidelines, which is this thick, and our packet, which is this thick, and I'm gonna test you on that. That test is a very difficult test. I would like to suggest that we allow the contractors to do the state testing through CPAL. If they bring in their certificate from that, then we give them a condensed test that only has the regulations from Custer County in it,
That's the way it should
instead of
be.
retesting them on the state guidelines.
That's the way it should be.
That is a tough test.
So what do
That
you,
became a question with, the name escapes me, the one that did some, inspections when you were first coming on.
Yes.
Because he did not have, or had not tested on our test and
Specific
had the state
items.
certifications.
I think we still need, because some of our guidelines are different than the states, are more stringent. I think we still need something.
You need
And
to-
maybe it's only a 10-question test.
That's right.
Instead of 20 pages of true and false and fill in the blank and, I took the test. I studied for it to get this job. It's a tough test.
okay, so get back to where you are here now. So 10.4 licensed cleaners, that's at the top of that page.
Yeah, so are you guys in agreement with that? I did not make that change on this because I've really been going back and forth, but would you guys be open to us changing the requirement to become a septic contractor, that they take the CPAL or state test? And then a more condensed version of what the Custer County regulations are, a test for that.
I wouldn't make them take the whole Custer County thing.
Well, just
It's
a
what they've taken
condensed
the other-
test. That addressed only Custer County.
That's what I meant.
Regulations,
Yeah.
yeah. I
I will
think,
work on making that change.
Make it clear.
We don't need to take the state twice. That doesn't make sense.
Let's see, 10.4 license system cleaners. We do not currently follow this. I don't see anywhere that we have any, I've never found anything in any file about, well, one person I found information on a pumper. I think there's some things that we really need to look at in this area. I like all of the verbiage here. We need to follow it to some extent.
So stop a second.
Yep.
So what we've got in yellow is a lot.
I like the verbiage here. I think it's important that we do some of this, but, I don't go out. If you look at like section 1, prior to issuance, I don't issue them a license. I don't know who's coming into our county and pumping. We have some, which is great. But I don't know who's coming into the county and I don't know where they're dumping. So I would like to keep what's in yellow here to some extent.
Well, then why don't you come back with what you really want?
Sure. Okay.
Because people, the septic pumpers, homeowners always, I've had my system pumped twice in the last 4 years. One of them was when the tree hit the house. We weren't in it heating the house, and so when you don't heat your house, you're not using the toilet or the washing machines, the septic tank freezes, which is unusual. You will never do it normally, even in 20 below, 30 below zero weather. So then you had thaw it out and pump it, but we pumped it, but pumping it is fine. So pumping is one thing. So when you call it septic cleaner, but that kind of confuses people here.
Yeah,
So this is the old language, is that what you're
Yes.
saying? So
Yeah.
you want to clean this up?
I would like to
Say-
clean it up a little bit. I think we need to, there is a class through CPAL again, I'm talking about that you can, that I think they need to take, because that's who's gonna, if a realtor's selling a home, somebody's selling their home, it's getting ready to be sold, they usually.
Say pump your system.
They have somebody come and pump it and inspect it. Apparently, we don't have any way to know if someone just starts pumping, did they take the inspection course? Do they even know what they're looking for? There is a course through CPAL that they can take that would teach them what things to look for when they're doing a septic inspection. So I think that's important. That they know what they're doing when they go out there and do that. We currently don't have anything in place for inspectors. And to me, that's, the pumpers are the inspectors. So I'd like to add a little verbiage in there.
Well, the contractor that installed it knows the system backwards and forwards.
So what I'm looking at here, we have on the books at the present time that they shall not do any pumping unless they are licensed through Custer County. Is that correct?
Yes, but we've never followed
But you've
that
never
process.
issued a license.
We've
And
never followed that process.
Yeah, what does that mean, really?
Yeah.
So,
I don't go out and observe a pumper that's just coming.
so what
in.
does the test tell you? What is the ones that are certified, what are they saying it takes? You gotta be able to get a microscope and go in there, it's the camera, what's,
I haven't
what do you
taken
inspect?
I haven't taken that course, Bill, but that is one of the things that they do.
Well, if we're gonna
recommend
require
in
somebody to
that
do
course.
something, we need to know what we're asking them to do before we make a decision on whether it makes sense or not. Cause right now, if somebody asks me, who I've installed many systems, plastic tanks and concrete tanks and septic. Before it was infiltrators, it was perforated pipes there. And you know the system, you know what it is, and you look for it. And now with the new regulations, you also have viewports at the bottom of the septic field and all that kind of thing. Then, and you know what you're looking for there. You also, you know roughly by, if you're following the regulations, you can't be too deep and you can't be too shallow.
Absolutely.
So do you have people that are trained? Now, maybe you take an additional, I want to know what else you would, another state or another county, what else would you do? You running something else. Let's take a look at that, because a lot of our septic installers can be inspectors like that.
I have not yet received anything that any of the installers have done inspections.
So,
So,
yeah.
but they may be,
I mean, I'm not saying they do, I'm just saying they could be, because they know the system.
absolutely.
So why don't we figure out what that is, Dorothy, and then let's figure out how you want to, how you want to order this.
Will do.
And that would help. I think it makes some sense.
How do you plan on inspecting that this sewage gets dumped where it's supposed to? They don't spill going down a road. Cause you can't expect what you don't inspect.
I understand. I completely agree. I do think that we should require periodic, however often that is, receipts showing where they're dumping. Because I have had a few anonymous complaints, and I have not been able to track that down, that there are pumpers dumping wherever.
No ditch, whatever.
Well, yeah, and there's always a crook and there's always somebody wanting to do something that they shouldn't be. I mean, or want to take a shortcut so they save some money. It costs money to drive back down to
It
Pueblo.
costs
Cost-
200. It
costs a lot.
cost, at minimum, the cheapest place I've been able to find is $250 a dump.
And that doesn't include the
that's
cost of
premium
driving
penalty.
down there and coming by.
Right,
the
that
whole
doesn't
cost.
include the fuel. It's a concern. It's also a concern in
But
my mind, and I've said this before, just shortly after getting in my position, it's a concern that we don't have a place for our pumpers to dump in Custer County.
Mhm.
If as the county, we could work something like that out to find some place for them to dump, we could reduce the cost for our residents, and we could keep that water in our county.
somebody
But-
tried though, and it was just not cost effective because they need a big hunk of land to do that and meet the criteria. That might happen in the future.
and
But
then-
let's go back to Lucas's question. Point is, you can't inspect what you don't, you expect people to be honest, first of all, and if you're caught, you're done. That's the way you get compliance. Is if you don't dump in a thing, then we will revoke your license. And so that's, to me, would be enough. Because you can't, just like he's saying, you're not gonna go around and chase every bumper down the road on every time they do. It's hard to track them. You don't even know when it's happening. So I don't know how else you could do it.
I think
except-
getting receipts periodically for.
Well, even that though, you could get a periodic receipt
Yeah.
and still go dump somewhere else afterwards.
No, but it's the effort, right? We have to make the
Yeah,
effort to
make it-
inspect or
Sure.
the effort and the people who
And there has to
make
be a
the effort to
statement saying
turn in the
that, yeah.
receipts are most likely gonna be doing the right thing. It's
Yes.
all of a sudden, you don't get receipts from somebody and you're going.
Yeah.
Well, did you close up your business or did you leave or just
Sure.
forget, friendly reminder, hey, but
So how, you gotta figure out how you're gonna ask for that. You're gonna have all pumpers are gonna be required to. Every other month, bring in a receipt, or what's it gonna be? Because,
And I, that's, like I said, these are proposals.
okay,
I'm getting where I
Well, we're
want
just
to
trying
know
to
where
help.
you guys stand on these issues, but we need to do something. And I'll put together after our meeting today, an updated
that's a good way.
document for you with the suggestions from our conversation today.
And I would put in the penalty piece, which is if you're caught when dumping in the wrong place, you're revoked. You're not gonna be a septic pumper in the county. Even one time, or you could say 2 strikes, you're out. I'm not gonna allow that. Anyway, something to think about. Good question that Lucas brought up.
Gotta get my bearings on that here.
You're on 10 something.
So these are just, I think. We already kind of talked about the inspector license, but I think the only change here, or the biggest thing that I would like to suggest. Is that. If an inspector or a contractor of any sort fails the system, that they let my office know. And the reason why I ask that is because if that system doesn't get fixed, then we have an issue. And it can be covered up, but we have a contamination issue. And I'm not saying I'm gonna go out there and do anything in particular, but I think that I should know about that. It should be noted in the file. Maybe a follow-up phone call to the resident or the contractor to say, because if they go out and they fix it, that's repair. They have to come in and pull a permit for that.
Right.
But
So
I
say it again, you
I
said
just want to
when,
make it
who- you're-
mandatory. I want to put a verbiage in here that makes it mandatory that they contact
who
our
did they,
office.
who
Any
can fail?
inspector, any failed system.
No, but who's failing? Who's the inspector doing it?
like you said, it could be one of the septic contractors. It could be,
He would, if he was asked as a septic contractor to go out there and look, he says, yeah, this needs to be fixed. You want to know about it.
absolutely.
Okay, I'm just making it clear. Who's reporting?
And a contractor is the same thing as an inspector.
I don't believe so.
But you just
But
said,
that's how
you said
it's
a
set up.
contractor
I
comes
know,
in,
I
come
said
on,
that
you gotta be
because you said-
consistent, so.
You said that they
In
can
that
do
case-
that, and they can, they know the system in and out. But if we say you have to take the CPOW test in order to be a inspector, which I think they need to. Then that would limit. Me just being a contractor and saying the system is failed. And I'll tell you one reason why I would like it to be a contractor in itself, like its own category, the inspector, is because we've had instances where we've had a contractor who was not certified in Custer County, fail a system, and that system was not failed. He was getting that.
Bilking the customer, bilking the customer. He was
Yeah.
trying to make a buck on the
Yes.
customer.
Yes,
Yep.
so
Sorry, couldn't hear.
basically a clogged line and they're telling them, oh, your leach shield is failed. And then, by the way, as a matter of fact, I need to put in a whole new system, tank, everything. And it, by the way, it needs to be engineered. I mean, I guess I just want to make this statement. We need to make the guidelines more clear for our contractors and hold them to that. I think for the most part, I know for the most part, our contractors work well with our office. And they let us know when there's a system failure or they're doing a repair of any kind. Usually they come in, they draw it out for me, we agree upon the design and we go from there. But as times get tough, we have a lot of contractors coming from other counties and they're not certified here. We just need to kind of keep.
I think-
I don't want I feel like, I know it's probably not my job, but if I know that someone's being overcharged or being hit, I guess overcharged isn't the right word, being taken advantage of, saying that something's failed and it's not. I feel like I need to assist that citizen.
Dorothy, I think we agree.
Yeah.
You said it.
Okay.
So you're the inspector, though, right?
Well, if I don't know what's going on out there, then I need,
But even if she wasn't, forget it about that. She's saying if it's been failed. If you're gonna do business in this county, you gotta tell them. And then that way she knows, and then that person's gotta say why it has failed and what did you do? Then she can say, you're, let's, because I'll tell you what normally
I
happens.
did,
It
you
would
know,
be an
There's a-
existing system that fell during pumping or something like that, not a new system.
And what normally a good guy will do, the right people do, they put a little pill in the toilet, flush her down and chase it. That's how you find a blockage in the pipe somewhere.
and a lot
And
of
then you
times
can go
that's
around.
what it is. It's a simple blockage.
So-
The pipes froze.
So all
It's
she's gotta
not-
get is somebody saying, I failed this system, and then she can ask them, well, why, what's wrong with it, blah, blah, blah. And then decide, put them on the spot.
And the other thing here is just changing the license revocation to, if we needed to revoke that to, make that
Be consistent.
consistent throughout the whole package.
Okay,
I think that's it.
good. Well, I think that's a good thing because, she asking them to tell you an Irish system that failed is fine. She's not gonna go out and become the second set of eyes and do it again. She's just gonna, it's a filter that says, because what value would that be? It gives her the chance to question them and make sure it's a legitimate concern before she go out and look at it.
I just know there's a big difference between an electrical world and plumbing world, between contractor and inspector, and they're not the two in the same person.
Right.
Or it would be easy for me, oh yeah, I put it, installed it for Bill and it failed and you need to spend $10,000
Yeah,
more, right? I mean, that would be a huge conflict of interest.
Right.
That we're pushing through.
Right, that's why, write it up. And we must see it.
I didn't follow you. Can you say that?
So Bill's the inspector and Kevin's my contractor and I'm the homeowner. He gets the contractor's license to install my septic. He should not be my inspector. Bill's my inspector, or you're my inspector, not the contractor, right? Am I missing something?
And that's usually when a system fail, what we're talking about more is a system that's been there for a while and
Oh,
it's
okay,
failed.
so it's already,
It's not a new system.
not a new,
In order for it to pass, she has to inspect it.
okay, new.
New.
No,
But
And
an
whether it's built by
existing-
me or you and me under my guidance to you, she still has to inspect it.
where
Once
I
it's-
think, oh,
Go
go
ahead.
ahead.
Once it's been, like she says, they fail for a lot of different reasons. The ground shifts, it's been, built a long time ago.
Tree branches.
Tree branches, roots get in there, whatever.
Yeah, and I think where we were at is we were on the pumping section and them inspecting these systems and failing them and then
So the pump truck guy that done the inspector?
that
Sometimes
was a question I had for her before because I think, I've
He's
had
a
my system
contractor.
pumped a lot of times before,
yeah,
not that many
case
times.
of, let's,
They just come and pump it. There's no inspection done.
but,
And you'd only get an inspection unless you ask for it.
if it's only,
And usually it's at the time that the house is being sold, that there's an inspection. It's a good idea to have it takes 2 more minutes.
most,
3 minutes most
most,
to inspect your system. Why wouldn't
Yeah.
you ask that?
so, yeah, to close, that's what. Well, they make,
You're not
most
learning
places,
all that.
mortgage companies now ask for a homeowner's inspection to be done before they'll even go through it on everything.
Hmm.
You got alarms, you got lights, you got a certified electric crap. All that, but in a lot of cases, take Art Nordyke as an example. All he ever did was install systems. Then he got into the pumping business.
Mhm.
So he knows, and he knows when the system, later on, here's the
Right.
things that happen because of the experience.
Hmm.
As opposed to a guy that just bought a pump truck and I'm just gonna go pump systems now for a few $100. That looks like it'd be easy.
Yeah.
You could get a guy that doesn't know enough about inspecting it to
And they
be,
need to, there is currently no training through the state for a pumper. but
right.
There is for an inspector. So I think that's important.
So that you make the pumper take the inspector.
Then he
test.
knows. Or the
I
state
see
criteria.
where you're going with this.
Yeah. All right. My fund meter's paid for the day. Are you guys, is there anything else, Dorothy?
Why not do another hour?
You still have space.
What time is it? It's still daylight out there. It's still daylight.
I tried rushing through it, but I may have missed some things, but.
Well, that's why come back with the final product and show us where the changes, what it was, and here's what it is.
So you still have space knowing like this.
I don't see anybody out there, maybe
Speaking to Carol.
not yet.
Hey, I was just here to answer any questions about the update to the MOU for the substance abuse grant. Bill, thank you for signing it. The school board had me update the percentage of breakdown for the school employee. It has nothing to do with Patrick, but it was just a minor detail that I had to change for them. So Jackie, yeah, perfect. So Jackie signed it last night at the school board meeting. So we just need your signature on it and it'll be done. And just so you guys know, this MOU will cover the last 2 years of the grant. So we won't have to re-sign this, and I will keep you in the loop and obviously visit with Dr. Brown and Patrick on what the school decides to do if they want to. They didn't have to apply for it. It was awarded to them, but if they're going to look to try and continue the grant or not. So I will just definitely keep you guys in the loop with what they decide to do after 2024-25.
Got it, and Dorothy has it. Now,
Perfect. Thank you so much.
I thought I did.
I will hang on to it for you.
Perfect. I'll come by and get it tomorrow.
Thank you, Stacy.
Thank you, guys.
Thanks, Stacy. Thank you for sitting so patiently.
Yeah. Were you playing
Not-
canasta? Were you doing solitaire? What were you doing?
No, I was I was at my office doing other work, so it still worked out. It worked out fine.
Thank you for being patient. All right, so I will adjourn this meeting.
Well, did we have consideration of approving that
Wait a
MOU
minute.
on the
No.
agenda?
Yeah.
So if we're doing.
Yeah, let's
that,
do it right. And we've
Before you
got-
sign that document.
Yeah, before I sign it again. I was in a hurry. So, all right, let's do it right.
Sorry.
No, thanks, Kevin, because I didn't even, where's the agenda? 'Cause
I have it up
I
here.
did not put it in there.
So after the new business, under new business, the only item we had was consideration of
Right.
approving amended substance abuse.
Okay,
prevention
and
block
Stacy
grant.
described it, and we've got it right here. Do you want to read it?
I'll glance at it really quick.
Let's make it legit.
Item 4, I think, is the only change.
Yeah.
I don't see that.
It's there, in the back page. there.
Number 4 was the change.
Yeah.
For Custer County being responsible for paying the salary and benefits to the school-based coordinator and the grant administrator.
Right, which is what we are doing. This is just
Yeah.
cleaning it up. That's why I didn't think twice.
I just thought since that was that way. on
Well, I
our
move
agenda,
that we, to get this legit, but I move that we approve that, or that I sign it.
I would second that. I guess, do we want to approve the amendment, or do we want to approve the signature?
Prove it as it is.
Okay,
That's her final, that's the final copy. That's the one Jackie signed.
okay,
So I'll
so I
sign it.
would second that.
All in favor, say aye. Lucas. Aye. Kevin,
Aye.
Kanda, aye. Thanks for catching that. Catching me wanting to go home.
Thank
Thanks,
you,
Dave.
guys.
So I will join the meeting now, adjourn it. It's actually 4 PM, straight up. Thanks, and thanks, Jordan, if you're still standing by, Jordan. You can turn this off, and I need to talk to you about turning on the Zoom for the Justice Center meeting. Is Jordan
Okay,
there?
I'll come over.
Okay, thanks.